Hello everyone, my name is Rachel Jackson and I used PowerPoint to educate patients on how there are different rehab facilities offered to them. Often in physical therapy, we deal with having to explain what a physical therapy's role is in the hospital and how we kind of come up with those recommendations on where a patient may be needing to go based off of the patient's current mobility. Whether that be home with family or continued physical therapy before they go home and kind of continue their functional household tasks. Before I go on, I wanted to go over the environment that this tool can be used in. This tool can be used in multiple environments, one being doctors' offices, especially those who are planning to have some type of an elective surgery. This can kind of aid them in their discharge planning and having to kind of come up with a plan on if they need someone to come in and help them, or kind of contacting their insurance companies to see what is considered in-network so that they have a good idea of what and where they can or able to go. Another would be just to kind of have this PowerPoint playing in the background on waiting rooms. Usually without the lecture portion of it, they can just kind of read through it and see what they know and what they don't know. And then there's also a review piece at the end where they can go back and kind of look through the slides. Lastly, would be in the hospital. At Lancaster General, we have a channel that kind of goes through the upcoming events or diagnostic testing that a lot of people might not be familiar with. So I feel like this could also be something where before the doctor comes in, or if the doctor is talking about going somewhere before you go home, you can kind of have a good gist of what is to be expected, or what facility might be meshing more with how you're moving. Some obstacles to this type of teaching tool could be cognition. In the hospital setting especially, we have a lot of patients who have dementia and or delirium, or they're just unconscious and they aren't able to really comprehend what rehab is or where I can go from here. So that could be some type of barrier. However, I think the family members that come in and visit, that would also be beneficial. Some might not be motivated or engaged to learning this. A lot of people are very reluctant to go to rehab facilities, but I feel like if they had the proper education on what a rehab facility is and what the purpose of it is, they would be more open to it. Some may just not be interested. And then not knowing that this tool is available to them. I feel like a lot of times doctors, and I know as a therapist, we go over this multiple times in a day with multiple different patients. Case management kind of gives them a little bit of an idea, but I feel like this is something that they can kind of take in control and slide through and see what they think of rehab facilities. In regards to the domains of learning, the domain here is the cognitive domain. More of a lecture piece, more of just an understanding of the material. Doesn't really affect emotions too much, and it doesn't really, affect any kind of skill. It just kind of makes them more aware of what's available to them. The teaching strategies used are lecture, which is this voiceover PowerPoint. Technology, which would be the PowerPoint. It's easily laid out, easy to read, very organized. And then the teach back method would be at the review part. It's at the end. Just goes through a couple questions to see if some people are able to comprehend the material that has been provided. And if not, they can go back through and see what they need to kind of fix or kind of work through. So let's kind of start here. The objectives would be to recognize the role of physical therapy in the hospital, identifying recommendations provided by the therapist in the hospital setting, recognizing what additional rehab includes, identifying the differences between rehab facilities, which we will go through, and then distinguishing what's in network. And I feel like a lot of people think they know what this means, and probably you do, but I don't think a lot of people realize how important it is when we're talking about rehab facilities. So the role of a physical therapy in the hospital setting is to assess mobility, assess the care that's available, and then based on those two things, we kind of make recommendations on your current mobility and if the patient's able to complete household tasks. So when it comes to options, many people don't really know what's out there and available to them. So each facility has a set criteria that allows them to either accept or deny you. And then these are kind of your options. We have an acute care rehab, the long-term acute care rehab, extended care facility, home health, outpatient, and then Lancaster also has a special program called the Neuro Recovery Program, assistive living, independent living, and personal care. So a lot of people don't realize we can also make recommendations. I'm sorry the slides keep shifting. It's not allowing me to do it on my own. But we also are able to make recommendations in regards to permanent living situations. So that's where those assistive, independent, personal care, those living situations also come into play. So the next slide I wanted to go over is, what is rehab? Why do I need it? Well, rehab allows individuals to gain the strength that they need in order to return home and to complete functional household tasks. So some questions that a patient may want to ask themselves before they truly feel like they're going to participate in therapy is there help available at home? Are you at a sufficient or safe level in order to return home? Are you functioning as you were prior to your current hospitalization? And is there a medical component that could be better managed in a rehab setting rather than just going home with home health nursing? When a physical therapy does their initial evaluation, they ask a series of questions that kind of pertain to the patient's home setup, and then they also kind of keep these questions in mind when they're thinking about, how you're moving around. So it kind of leads them to their recommendation. This slide gives you kind of a quick overview of each of the facilities offered to you, which are at the top, and then it gives you kind of different criteria or different types of intense therapy, the amount of therapy given, the physicians that are there. So it kind of gives you a good quick overlay of what this is or what rehab facilities are available. So the first type of rehab would be the acute level care of rehab. It's intense therapy. It's approximately 3 hours a day, up to 5 to 7 days a week, and it can include 3 different principles or disciplines that include physical therapy, occupational therapy, and speech. It's intended for those who are needing that intense therapy, but also have medical complications, which would indicate that need for nursing care that they have available there. It's available 24 hours a day. So if you don't really need that, you can't. Your insurance company might not accept you. So just kind of making more people aware of that. So examples of this would be the Lancaster Rehab Hospital, Health South, and other ones. Long-term acute care is kind of like the acute care that we were just talking about, but it's not as intense, but it's for patients that are more medically complicated, and that's kind of what's holding them back from being more physical and more mobile. So it's less than 3 hours a day, but that length of stay is 25 plus days. So it's a very long time, but the focus mainly is on that medical management with those who have chronic medical conditions. So RN care is available 24 hours a day. The next one is extended care facilities. This is that nursing home level of care, which many people are more aware of. It kind of gets a bad rep, but they do offer really great rehab these days, which a lot of people don't understand. They think that they're going there to live, but a lot of times we're making a recommendation for that rehab component. So it's intended for those who aren't able to tolerate the 3 hours a day therapy due to fatigue issues. Therapy is given typically 3 to 5 days a week. The RNs are not available there all the time, but they usually are on call or they're there sporadically throughout the day. And then if a patient improves, they can transition to the acute care rehabs just because this is made for those who are having those fatigue issues, who may not be able to tolerate those 3 hours a day, but if their fatigue comes up or if their endurance levels come up and they're able to tolerate 3 hours a day, they can also resubmit to go back to an acute care facility. So as well as the rehab component, they also have the permanent move, which is where people kind of get confused. It's for those who are needing assistance with all daily tasks and who aren't able to live alone, but they're needing 24-hour nursing care or that LPN care. So they can still receive therapy. it's just more of like an outpatient thing. It's more of a 1 to 3 day a week. So here is kind of just a quick picture, a quick look at the difference between acute rehab and the skilled care nursing home level of care rehab, because a lot of people get really confused on this, okay? So people can look through that, kind of justify the differences. So home health care is intended for those who get what we call the clear to go home. And what that means is that you're not discharged from therapy. It's that you're at a sufficient level to return home with the care that is needed or the care that you have available, such as family or if you have aides that come in. But then you can continue your therapy from your home. The therapist comes out, they see you. There are restrictions to this, though. The patient is having to remain homebound, so these patients can't go to church, they can't go out and get their own groceries. The only reason they should be able to leave is to go to a doctor's appointment. So with this, the therapist comes to the house about 30 to 60 minutes, 2 to 3 times a week. Outpatient rehab is what a lot of people are familiar with. This is for those who are typically, pretty mobile, pretty active, and they're wanting to get back to that more independent lifestyle. So these patients are functioning well enough to go home. To go to an outpatient setting, you pretty much need someone to drive you, obviously, or you can drive yourself. It's for those who are higher level, like I said, and this is usually 2 to 3 times a week, approximately 45 to 60 minutes, usually requires a co-payment from your insurance. And then we have something called the Neuro Recovery Program, which is kind of special to Lancaster. A lot of people don't realize it because it's in your normal outpatient setting. I know there's 2 places in Lancaster that offer it. So this is for those patients who have a neurological, vestibular, those neuro things going on. So strokes, traumas, those kind of patients. The nice thing about this, though, is that these patients are able to go home with their help that they have, but if they're needing to get back to more of that independent lifestyle, kind of like the outpatient therapy, it's intended for those, who may need coordination, sensation management or sensation exercises, and then also sometimes that cognitive component as well. Here's just a quick picture of what a outpatient therapy gym may look like. Alright, so insurance. As many of you know, there are different insurance plans, such as Medicare. Right here we have all the parts, and then you also have supplemental. It's very confusing, but the big thing to understand is what is in network. It's important because this can limit what facilities are available to you, and a lot of people don't realize that. So let's say you have your insurance company and they only accept 4 facilities out of the 50 that are offered. Well, that's where you have to remain. You can't really go outside those 4 facilities because your insurance is kind of dictating where you can go because that's where they're willing to pay. So this is where patients and also therapists, we get kind of frustrated because, we believe based on your mobility that you would benefit from going somewhere or what have you, and the patient is really wanting to go to this facility, but it's considered not in network. So kind of making sure that you understand who is in network and calling your insurance companies to fully understand is something that I think would be beneficial before you have, those elective surgeries or things like that. So permanent living situations. While physical therapists are able to recommend rehab facilities, we're also able to recommend living situations, which many people aren't aware of. And despite us making the recommendation, just remember that it is just a recommendation. We can't force you to do anything you don't want to do, but it is beneficial for those who are, especially family members, I would say, because we're educating them on the options of living situations. And why we are recommending that maybe a permanent move may be a better solution. So these can include independent living, assistive living, personal care, and like we said earlier, that extended care level. So in independent living, these individuals are able to live on their own. but they're kind of needing help with all those extra things, like landscaping, cleaning, security, meal prep. So that's where they kind of have a dining hall, those things. So the nice thing about these facilities is that there's clubs, there's many activities, many opportunities for them to be involved. And then with this, in regards to physical therapy, they are required to be at an independent level. So they are having to do, more mobility on their own and not needing help from anyone. Assisted living, again, able to live on their own, all those help for landscaping, meal prep, security still involved. But the other component of this is that they're needing increased assistance for what they call their ADLs and IADLs, which can include bathing, laundry, medication management. So with these facilities, faculty is usually on call for the patients when they're needing help. And then again, clubs and activities are offered. And again, they are required to be at an independent level with mobility. So they're just getting that extra assistance for those ADLs and IADLs. Personal care, or those hired caregivers. So this is something that people usually use before they make a permanent move. Patients can hire people to come to their home or into their assisted living, and again, they're helping with the ADLs and the IADLs, so the bathing, laundry, medication management. Also kind of having someone there to help with taking to appointments, providing companionship, some housekeeping. A lot of people hire their caregivers per the hour, and then they can also increase and decrease the amount of time depending on why they're there or what they're needed for. And then typically these services are out of pocket. So with all of these kind of living situations, it is considered more of a personal move. So it is out of pocket. There is not really much insurance involved. I know with the hired caregivers, you can kind of get Medicare involved, and they can help pay for certain things, but that's something, outside of my realm of educate or my professionalism. So that's something that you may want to talk to in regards to like a social worker. And then the last part that I have here for that teach back method is the review. So it takes you just through a few questions, and then the last thing is the references. So this is my PowerPoint in regards to what rehab is and what physical therapy in the hospital setting does in order for you to get where you need to be and then to be successful for when you go home. So I really hope everyone enjoyed it, and hopefully you can take some of this information and apply it to your grandparents, your parents down the road, and even yourself.